This presentation should take between 15 and 20 minutes and really is designed to be a preview of what we're all going to work together on next week. The sponsors of the program are the UAA Business Enterprise Institute, the Bristol Bay Native Corporation, Champney Consulting, of course, and the Alaska Mental Health Trust. The organizing team are Nigel Sharp, who's our global entrepreneur in residence, Kim Champney with Champney Consulting, Eric Boyer, and then me, Jacqueline Summers. Now, keep in mind that I've been involved in a lot of programs, but I tend to be behind the scenes. So bear with me as I try to kind of step forward into the camera limelight. So why introduce startup tools and methodologies to social programs? Well, one of the ways that I was introduced to the power of what these tools can do is when I first worked with Nigel and others in the Ocean Technology Innovation Sprint. And one of I was truly excited by Otis because what I saw is when you bring a diverse group of people together and lead them through a program, they can come up with something amazing and new by combining their energy and their creativity. So Nigel and I worked on the Otis program for about 2 months, and we worked with a variety of different participants, including a remote team that worked all over Alaska. But there was one participant in town who approached us afterwards and told us about a particularly difficult problem he was facing. And that's Ryan Witten, and he was working with Seeds of Change, and they were facing being shut down. And he wondered if some of the methodologies that had been a part of Otis might be able to solve some of the problems that they were facing. Seeds of Change, if you don't know about it, is a really innovative program. It works with 2 different missions. What it does is it tries to work with at-risk youth and teach them, train them in employment and workforce development skills, while also providing fresh produce to the Alaskan market. What we learned when we were doing the Seeds of Change program is just how powerful some of these tools could be by bringing entrepreneurs and social ideas together, but we also learned how challenging it can be. So sometimes what Nigel and I weren't totally aware of is how different some of the mindsets can be in organizations, and how changing the idea of how you look at things might actually bring new perspective. While I was doing the Seeds of Change program, I actually was super excited about it, and I reached out to Kim and told her about this. I wondered if it had any validity in the work that she was doing and in the programs that she was working on. And so, of course, I got her roped in, and she actually started to participate in the next program that we worked on, which was the Innovation Dash. The Innovation Dash was, again, it's another way to introduce people to different startup methodologies. We brought in a team that taught design thinking to a whole group of different organizations and industries in Alaska. And what we really learned was that these methodologies can be applied just about anywhere. Anybody who's trying to solve a particularly interesting challenge can maybe work through understanding it and then prototyping it. One thing to think about with doing the when working in social programs is how very difficult the problems are, and we like to call them wicked problems. And you can see here a wicked problem is a social or cultural problem that's difficult or impossible to solve for 4 different reasons. And it's usually the number of people involved, how difficult the knowledge is to understand, how very expensive it is, and just how interconnected these different problems are. So one of the wicked problems that we wanted to try to address is the one with direct support innovation. So working with Kim and our colleague Margot Fliss with the Center for Economic Development, this past October, we did a 2-day mapping event, and some of you were involved in that, in which we tried to directly understand the wicked problem of direct support innovation, or direct support professionals. One of the highlights of that event was bringing in 2 different organizations that work with startups specifically in the health technology sector. One was with the Cedars-Sinai in California. Ann Wellington is the director of that program. And then we also invited Tom Bass with the Boomtown Accelerator. They spoke to the participants, and they talked about the way that their organizations reach out to startups who want to address some of the challenges with doing direct support innovation. Nigel, do you want to take a minute and tell everybody about the 10-10-10 program?
Let me figure out how to unmute myself. Oh, there we go. Okay. I think the narrative that was running through those various previous slides is an important one. I really want to express this as every single person that's on this call today and those who are joining us next week are going to continue being part of this ongoing narrative that we're having around the need for us to take in enterprising and innovative thinking into the world of work that we're currently operating in. So I was actually inspired with this when I first moved here to the US. A little bit of my background is I've been involved in technology startup companies, software primarily, interested in everything from human-computer interaction to cybersecurity. And I never expected myself to sort of land in the world of getting involved in social entrepreneurial activities. But I was actually inspired by people such as the gentleman pictured. His name is Tom Higley, who was a dot-com era startup entrepreneur, exited his first company, I think, at well over $1 billion, and realized like later in his career that to have the most meaningful impact in work that you do, that you can apply your startup techniques and take these entrepreneurial skill sets that you have and apply them to some of the much more complicated problems that most entrepreneurs, for the most, don't generally address. So he built this program called 10-10-10, and I was very fortunate to be able to participate in 10-10-10 because what they did is they took 10 prospective CEOs. They then challenged them with 10 wicked problems over 10 days. And these 10 CEOs were all transitioning CEOs. Each CEO was given, I think, 2 to 3 ninjas to work with them. And that's the role that I got to take on in that program. And it was a fantastic, set of events. I mean, the CEOs are working day and night, working through hotel rooms, running around town, doing customer discovery. And almost none of them come from a background that they were focused on. The specific 10-10-10 was actually focused on health. And it was 10 challenges, things like dealing with obesity in youth, or dealing with toxic stress at early childhood, and so on and so forth. They were dealing with some really, really wicked problems, and they really specified what those were, gave people an opportunity to learn a bit about them, and then challenged folks to look at this from an entrepreneurial hat and see if there was a potential enterprise that could be formed around that. Pleased to say that 10-10-10 has evolved over the years. They've had a number of programs run now. A few of them have been focused on health. And 10-10-10 has evolved into a number of companies that have gone on to raise venture funding and grow and solve this. So I got to see at that end that there was a real power in just bringing folks together, even if they weren't specialists in a particular field, and just giving them the access to start looking and solving problems in space. And that led into a program called Big Five, where we took on, I kind of cheated and copied 5 days, 5 problems, and it was kind of half a 10-10-10 program for all intents and purposes. We ran that out of the University of Colorado in Boulder, and that led through this narrative that Jacqueline's given you, where we've connected from Otis through the Innovation Dash and Growth Space programs. We've had individuals who have managed to intertwine and get interested in these various spaces and come together to say, well, wait a minute, there's a real challenge here in this direct support professional market. And to be honest, it was a market that I have personally very little experience with, but I'm pleased to be able to sort of take and run this program and facilitate us through the next month or so of different activities that we're going to be doing to help drive this conversation around the DSP market and what we could be doing if we bring in a little bit of an entrepreneurial, innovation-centric stance and try and embrace some of the tools that we've been able to experiment with over the last year. So you guys are very much part of that narrative, and our hope is that as we take that program forward, it evolves and it brings a new perspective here to Alaska. What we're doing is very innovative, much like Tom Higley just a few years ago when he started 10-10-10 and has created a global movement around it. What we're doing here in Alaska is also hugely innovative in the sense that we are off the beaten track, and we have to understand that being in Alaska, our startups aren't coming to us because we're not a Cedars-Sinai hospital, or we don't have a John Hopkins or whatever else it might be, that entrepreneurs are walking in the door and saying, how can we help solve your problems? Instead, we're all the way up here in Alaska, and we quite often don't get to see those guys come by and engage. And even the local entrepreneurs don't necessarily know about some of the challenges and problems that are being faced. So we've come together to really help go forward and create this health tie program, and really sort of drive that from this previous program that we did, which was the Growth Space Direct Support Innovation program that we had. So I'm going to pass this back to Jacqueline, and Jacqueline, maybe you want to run through some of the wicked problems that came out of that program, and we'll soon be breaking for a quick Q&A.
All right. Well, thank you, Nigel, very much. And it's always nice to have such a practice presenter participate. So the mapping events that we did with the Growth Space Catalyzer, the Direct Support Innovation in October, we found that, these problems are probably very familiar to many of you. The real problems are that there's a declining recruitment and retention of direct support professionals for a variety of different reasons. But then we also know that what they do, the difficult work that they do, is very misunderstood. There's declining recruitment, that often the administrative processes are overburdened and redundant, and that there's barriers to accessing any kind of training. And that these workforce issues are part of a larger workforce within the healthcare industry that is often has trouble finding professionals in it. One of the things that's most exciting about the Health Tie event next week is that Tom Bass, who spoke to the previous Growth Space event in October, the one in which we mapped out the direct support professional challenges, Tom Bass will be coming up to join us in person next week, and he'll share his experience and understanding of what they're doing in Colorado and throughout the United States and the world. Because often when people are in this space, there's a lot of interconnectivity and a lot of people together, working on it together. I don't know if all of you know what a business accelerator is, but basically it's an organization that works to help startups get started. So they often provide funding, support, mentorship, and also their connections and networks. The one in Colorado that Tom is a part of works in the health and safety area, and I think we'll have a lot to contribute to what we're trying to do next week. The reason that we're trying to start a testbed program in Alaska is that we know that organizations are hard to access. So even if you have a startup idea, you might not be able to get in and meet the right people that will help you test it. And so startups need access to information and to resources and systems, and they need to come in and better understand where the problems are. And that way, when they're trying to solve them, those solutions have a better ability of actually working. So the Health Tie program that we're working on is to build a program that will be a place to test bed or prototype ideas for Alaska. People would work one-on-one with the organizations to then try to solve their problems. So, of course, this is simple in theory, but it's hard in practice because it means better getting in and understanding the people and the cultures. And what I've seen from my own vantage point is that people often want help. Organizations might want help, but they can actually be very hard to help because they're often in so much crisis that they can't actually stop long enough to help you help them. So what we're trying to do with the Health Tie program next week is that we've brought together a select and diverse group of individuals, people involved in the human services and healthcare funding and entrepreneurial ecosystem building, and those with entrepreneurial experience to build a prototype program. Where we'll be meeting next week is at the Bristol Bay Native Corporation. And we'll be meeting on January 24th and 25th. One thing I wanted to let you know is that we'll need to each check in when we come in, and there's parking behind the building, please. Now, Nigel, would you like to wrap up our last slide and tell everybody kind of what the next steps are?
Sure, happy to. Thank you, Jacqueline. Thank you for the presentation, Jacqueline. So, okay, so yeah, we're taking this next week. Just to give you guys a bit of a sense, this is going to be a fairly fast-paced event. I will be your lead facilitator. I'll be there to chaperone, hold hands, but mostly make sure we get some work done together. Those who have had a chance to work with me in the past, we have a few of those invited to this, know that it should be a fun yet fast-paced set of activities that we've got planned over the 2 half days. The reason for the 2 half days is primarily to give you guys some time to go and stew on things and think of things. Some of the stuff that I saw at 10-10-10 happened at those late hours in the hotel room just before people went to sleep or first thing in the morning. And sometimes having a break through the night is actually a great way of helping us process so much information. So very much look forward to having you all come by. If there are questions, Jacqueline has been a great point of contact and she's helping with all the communications around this. So feel free to send her questions and we'll try and respond as quickly as we can. A couple of tips and guidance points around this is I would say dress business casual for the most part or comfortable to work in. It helps the creative flow in really trying to make this work. I would ask that although you may already have some ideas of how we can do this or the right way of doing this, I'd really ask you to try and come in with a fairly fresh mind and try not to bring in too many biases around this. I am interested in what's been tried before, previous stories of startups that we've actually had engage with the DSP market here. So yeah, definitely refresh yourself on those kind of pieces of information. And in the meantime, my request to everyone on this call and those who are going to be watching the recorded video afterwards is to please have a look through the growth space report that came out from the last Catalyzer. Although we won't be tackling any of those specific challenges outlined there, it will give you a sense of the type of work that went on. I really want to reinforce that last event, we brought together 25 or 30 people here in Alaska who were experts in across the field, and a number of those, some of those folks are coming into this program as well. But we're really trying to bring in a new base of individuals as well. And as we grow this program forward, and as you sort of got from that earlier narrative, as we take you guys through this story, we're hoping to be able to sort of just keep building on to all these various successes and various programs that we've had, and just keep intermixing those diverse thought sets that we've been kind of like randomly, but it seems like almost intentionally bringing together at this point. So where does it go? Post next Friday, we're going to be taking this then forward about a month into the Innovation Summit. So I'm pleased to announce that the end of the Health Tie program will probably be happening around the Innovation Summit. So the outcome of next week is, of course, hopefully some program designs. We'll be thinking about and having that and making that presentable. And then over the following few weeks, for those who are interested in participating, we better refine a few of those designs and have them set up to be presented at the Innovation Summit. For those who aren't familiar, the Innovation Summit is an event. It usually attracts about 350 people. It gathers a lot of the state's most active entrepreneurs, as well as economic developers who support this space, and legislative folks who are engaged in entrepreneurship and startups, as well as I think probably the majority of the funders who are involved in venture capital are also at the Innovation Summit. So it's a fantastic opportunity. Personally have been to the event before. I think it's a great place to be, and it really fits very well into what we're trying to do. So we're hoping to have a track centered around healthcare advances, and I really think this is exciting that we're getting to put out the direct support professional challenges and be able to talk about that to a much wider audience across Alaska. So that'll be down in Juneau, February 20th to 21st. For those who won't be able to physically make it down there and join us, which I totally respect, I'm going to try and have a webinar and make sure that the proceedings are recorded. But it should be, part of that is going to be what we're going to be designing for next week, is making sure that we have a follow-on next step and that this conversation just doesn't die off. 3 months ago, we got to do the growth space DSP program. Now we're getting to do this. In a month, we get to go to Innovation Summit, and I'm hoping that we rapidly ramp up and keep the energy going fast down this track. So with all of that said and done, happy to take any brief questions. A lot of things will become clearer next week. There is a reason why we haven't gone into a lot of detail about the program for next week, and that's primarily to stop you having too many biased ideas coming in. But I'm happy to field any questions that may have occurred, and I'll quickly have a look at the chat window as well. So, and thank you again, Jacqueline, for presenting.
Well, thank you for having me.
That's great. Cool. Do we have, so anyone can welcome to just get up and speak, and I'll try and see if I can stop sharing the screen. Please remember to unmute yourself if you do have any questions.
It's 1:30, but so, and I know many of you, but my name is Kim Champney, and I'm a consultant now, but I worked in social services for 20 years. And I'm so excited because I think what Nigel said, that this is very cutting edge and really forward thinking, is true. I think Alaska and this project could really be a model to really shake things up. Some of us online have been talking about how do we recruit and retain qualified direct support professionals for 20 years. We've been talking about that. And when you have the same kind of people having the same conversations, you just start recycling through the same ideas. And so the intent next week is to get some of us online, just come from that place of social, working in the system. And then many people on the list that we've been working on are people who are also online, that you all, like Nigel, who come from that entrepreneurial, energetic, that startup mindset and culture. It's very different energy, and mixing those two together, I honestly feel we could make an impact in that. Like I was sharing with Nigel and Jacqueline, for my social worker, make the world a better place, like in a really, I think, meaningful way. And so I thank you all for committing to next week, and I'm really looking forward to where this goes. I want to do a shout out, Eric Boyer at the Mental Health Trust. This is not a one-time, like next week or even the Innovation Summit is not the end. It's just the beginning. And so it's really going to be a shift toward making a difference in this situation that we're facing in the service system for people with disabilities. And anyway, I just wanted to share that. So excited about.
Thank you, Kim.
Yeah.
Thank you, Kim. That was fantastic. I do appreciate that. So I like to keep things timely. We're at like 1:32-ish. So I sort of promised to take about 30 minutes of your time. Totally agree that, as we mix these different folks together next week, that we're going to create some kind of bang, and we'll see how that goes. So I'm very much looking forward to meeting you all next week. For those who, again, have any other questions or something else pops into your mind, feel free to reach out to Jacqueline. You should have her contact details now. If you don't know why you're on this call, then yeah, definitely reach out to Jacqueline, and we can try and figure out how that happened. But other than that, I want to, again, thank you for your time. There will be a recording from this webinar where you get to go back through and look through the slides. I'll try and include the slides as well via an email. We might have a couple of ancillary videos, and most importantly, we'll include a copy of that growth space report that we did at the last program. So all of that to follow up, some fun reading materials for your weekend, your nice long weekend, I guess for most of us, and look forward to seeing you fresh and bright. Was it Thursday, about 1 o'clock-ish, down at the Bristol Bay Native Corporation?
Thursday, 1 o'clock-ish. Thank you so much, everybody, and thank you for participating.
Thank you all. Appreciate it.